just to say there's a whole variety of things we're looking at. And part of it is the context that we're in, both in Canada and in North America. That's important. So we need to be cognizant of what's happening across the country and in our jurisdictions that are around us, because that affects us as well. So things like putting in our border measures are really important. Recognizing that we're at the same place as our neighbors in Alberta, across the prairies, what we're looking at in Ontario and Quebec as well. So those are some things, what's happening around us. We'll be looking at what's happening in BC, where the outbreaks are, how much we're doing testing in the community, our ability to detect outbreaks, but also in some of the modeling will help you understand, or help us understand this, what are the signs that we're starting to see increases again. And then we'll be looking at what are the things that are most relevant to get going in our communities and in our healthcare sector. So there's two sort of different things that we're looking at right now. What are the things that we need to get our economy, our communities, getting people going, and what are the things we need to do in our healthcare sector that we can manage so that we can take care of increased numbers of COVID-19 should we start to see them without compromising the rest of the care system. So it's complicated, and we of course are watching what people are doing in other countries where they're trying to take off restrictions to see if there's ones that we want to stop with. I will say that the basics, the hand hygiene, the safe distancing, the making sure that our workplaces are able to have the enhanced cleaning, the safe distancing, the working from home, those are things that are not going to change for a while. Those are things we're going to have to be continuously thinking about doing for the next coming months, until we have enough herd immunity that we're not going to get a dramatic increases and rapidly increasing infections in our communities. We're also looking very much at the public health system and how do we support the ongoing testing and contact tracing that's needed to help us keep an understanding of where things are happening in the community. So it is complex, and there's lots of very wise people with way more expertise in this area than me that are looking at this over the last coming weeks, and we'll be describing some of this in more detail later this week.